I'm here with Redeeming Our Communities. Now, we love chatting with ROC. They do so much stuff. We love what they're doing. But this is something new, it's exciting, and somebody I haven't yet properly introduced you to. So let me first say hello to you, Rebecca.
Hello. Thank you for having me.
You are very welcome. Now, we've met a few times, properly met at the Redeeming Our Communities celebration of 20 years. Have I got the right number?
Yes.
Yes, the 20th celebration, which was brilliant. We had a bit of an interview then. So just because I want to get into all the ROC stuff, just give us a really simple overview. What is ROC? I mean, I've just chatted to Paul Blakey, who's ROC Angels, Street Angels, Festival Angels. So what exactly is ROC?
Love Paul, by the way. Shout out to Paul.
Any fab.
So ROC stands for Redeeming Our Communities, which basically we are people of goodwill working together towards a safer kind of community. That's the strap line. That's what our aim is. So we love to go out into any community. It could be, in the UK, it could be international. We launched in Australia a few years ago. So it is really any community that has a need and we just love to galvanize that community, empower them to then try and meet some of those needs, provide some solutions.
I think we're talking off air, weren't we? But I think it's so important that so often we just need to listen to people.
Yes.
I think quite a lot of the time we know what we need to do in any given scenario, but sometimes the situation kind of overwhelms us. So we could do with somebody who says, yeah, actually, maybe you're on the right path. And so often we don't need people to fix us or what's going on. We just need them to listen, because genuinely, I think people are amazing and fantastic individually, and we have so much we can do, but we just sometimes need a little bit of help just to collectively gather us together to say, do you know what? Let me introduce you to somebody else with a similar passion. What can two of you do?
Yes, definitely. That's exactly it. I think that I have this fix it mentality sometimes, and I really need to fix that. Listening is so important. It's so healing for people. And somewhere, my way of fixing something might not work for that person. So all they want to, when you're feeling overwhelmed and this life gets too much, the last thing you want someone to do is say, have you tried this? Have you tried this? You want them to come alongside you and say, wow, that must be really difficult. How have you coped with that? What things have you tried already? Because people do try, to fix it themselves. And it can be quite condescending, can't it? Oh, have you tried going here? Have you tried this? It's like, yes, I've done everything. Obviously, I'm not stupid,
I heard a brilliant talk years ago now, and it was about, it was a group who were working with people who are basically in poverty. And they were saying one of their frustrations with this group they're working with is having to educate people, because they say that the problem with these people is they're not eating well, they're making stupid decisions, look at what they're doing. And they said, you're misunderstanding everything. These people don't have good protein or diets. Immediately the brain starts to function less well, and then you're not making good decisions. So it's not they're stupid, which was one of the comments they picked up on. They can't make as good a decision as they could do in your situation, where you have a nice meal and a nice house and you're wonderfully warm. If they don't have that, then their decision making already is now not so much what do I fancy for dinner, but can I feed my kids today, which is a whole other world.
Exactly. Education is key. And that's something that we've brought in, this a signposting service to add on to what we're doing, so that we can raise awareness of what's going on out there. What are the things that you could tap into, and educating ourselves on diet, nutrition, everything does empower us, doesn't it, to make positive choices.
And I think it's that personal empowerment bit, isn't it, that is so important, because sometimes, I use the example of the police. Sometimes we need somebody to come into a situation and say, no, that's not okay, we're going to stop you. That's the extreme end, and that's not the norm for most people, where we just need a signpost. We just need encouragement. We just need to say, I think I need to do this, but I'm too scared to do it. That sounds like a great idea. That individual personal empowerment. But I come back to that two-person thing, because I heard once you can't carry two halves of a piano as easily as two people can carry a piano. I don't know about the physiology, but it's a great idea that we can do more together.
Yeah, well, and that's what we believe, and we're all so different and unique, aren't we? That the team in ROC, I love it. We complement each other so well. We're all different. We all have different skills, different things that we can bring, and that the human body, the body of Christ. It it takes a village to bring up a child. It's all these principles that we've learned all the time, but then we often go out into a situation, try and do it all on our own, and it doesn't work as well. Agencies aren't working together like they should be. The NHS, the police, it's not working. The system needs to change, and everyone needs to collaborate in every situation, in my opinion.
I I am not disagreeing at all with any of that. Right. I want to come back to ROC and the project that you're particularly involved in at the moment, but let me just go back just a bit more in time. You're working for ROC, you're talking about Christianity and stuff, but what's your story of faith? How did you meet Jesus, and how did he become a part of your life?
Well, I was blessed enough to be brought up in a Christian home. Both my parents are really strong Christians. From the day I was born, it was part of my life. I went to church every Sunday. They were heavily involved in the church. My father was a minister. My mum ended up becoming a minister, and did a lot of pastoral work. They did a lot of counselling. Then mum started the charity ROC. So we had many nights stuffing envelopes when she used to run Prayer Network years and years ago. We used to go to the conferences. So my life has been surrounded by this beautiful, experience of Jesus being at the center of it, the community of the church being everything, and I think it does it's part of your framework of life then, isn't it? That is what I was born into. So that's where I go when I need support, and I've got all these people around me that can help me. So yeah, my Christian life has been very, very smooth in that sense, that it's always been there for me. I've had a lot of experiences through life as well as you get older and things have gone wrong, but my faith has never been shook because of that foundation,
Hmm.
in my opinion.
So you're raised in a Christian context, which I can recognize that in my own life. So going to church and all that. But where did Jesus become more than my mum and my dad love Jesus, and now I love him too? So how did that switch for you?
Well, when I was younger, I started a youth group in the evenings called Free Spirit, and I noticed gaps in the church. We always do, especially for young people growing up, and it could be quite rigid. There wasn't very much flexibility. And I thought, no, we need to be free in the spirit. We need to be able to be who we are, without offense being taken. So I used to run Friday nights. I loved it. It was amazing. Just getting all kids together. We used to get guest speakers in. I think I was like following in my mum's footsteps, just enjoyed that. So yeah, it was, and then I had times in my life where life was quite hard, and leaning on Jesus was the only thing that sort of worked in those situations, and you feel like it's too difficult to cope with. And I don't know whether it's part of my personality. I can just move on from, really difficult situations, I think. But yeah, Jesus, that was really for me, the free spirit, seeing people together, doing it our way.
No, that's fine, and I can definitely see something of your parents in who you are and what you're doing with all of that. Because I mean, look at ROC and what your mum's done and set up. So let's just move on a little bit of time then. So you're now working for ROC.
Mm-hmm.
It's not exactly an elephant in a room. It's the organisation that your mum and dad are there. Your mum set it up. But how did you find yourself? Because you don't have to work for ROC, right? So
No.
it's obviously a choice. You want to work, which says so much beautiful positivity about your family, that you want to work with your parents. Many children wouldn't, may not be necessarily appropriate for all. So what got you into working? Why do you want to work with your mum?
Well, I used to work for big major banks. So my first job was working at Barclays Bank behind the counter. and I worked my way up. I loved sales. It was my thing. And I ended up becoming one of their financial planning managers, which was such an exciting role, working with very wealthy customers, working with stocks and shares, pensions, life insurance, all that boring stuff. But I loved it. I was second in Manchester year on year, or, top 10 at least, and loved sales. I think that's one of my skills, is good at selling things. But I found I got headhunted and moved over to HSBC, and I found it really difficult to work in a banking environment with a faith, because not to criticize, but it's not the same. They're all about the numbers. It's got to, every person needs to result in a sale, whether it's right or wrong. And I didn't like that. If it wasn't right for that person, I wouldn't recommend something. So yeah, it wasn't great towards the end. I was there 8 years, and my mum told me about this restorative justice project that they were releasing in 2013. And when she told me about it, I dropped to the ground. Honestly, the Holy Spirit hit me right in the face. And I was like, that is what I need to do. And my mum's thinking, well, no, because you've got no qualifications. Like, actually, we want someone that's really good. And actually, it'll be awkward having you working there. What if you don't do well at it? And it's like, I need to do this. And I applied. She got a panel involved for the interview process to make sure it was fair. And there were 13 people, I think, and she was floored. I did the presentation. She could not believe it, because it was God. It was God in there with that burning desire to help people in a proper way, change people's lives. It's something that's been in me. I've just not been able to use it. But in a way, I think it was all training, working in the bank. It's all training, preparation for when God's timing's right. And then when she released that project, that was just, I loved it. And I got the job, and she couldn't believe it. She was like, I couldn't believe you knew so much about restorative justice. I couldn't believe that you had so much empathy and you'd done so much research. I'm like, yes, at the time I was 28, I'm not a kid. I know what I'm doing. That's how I got involved, and I've been richer ever since, even though the money compared to what I was on significantly less.
We value wealth differently, don't we? And it's something that's kind of hard to verbalize into anything that sounds rational or sensible. But actually, when you're serving God, when you're following God, when you're trying, not perfectly, because hey, we're humans, right? But when we're trying to do the best we can for God, it's amazing what then happens. But I especially love that your mum said, right, I'm going to get paneling because I want this to be fair, because otherwise, oh, well, it's just a daughter. And all of a sudden it can just snowball into something negative. But actually, even that, I'm not surprised by your mum doing that, by the way, but it smacks of God is in this.
But I think it was more because she didn't want to let me down. If it come from someone else, then it's, I'm really sorry, it's just not the right thing. It's a lot easier to say no when there's 3 other people here who are all saying it's someone else, Yeah.
No, I get that completely. So restorative justice, I want to come on to the mental health work now, but restorative justice, I have a small amount of knowledge. What I know, and maybe you can just fill in some blanks, but restorative justice is basically an offender. They've been through court. It's been right. This is the person that's done this. So that there's no question about that. You then put that person in a room with the victim, not quite like that. And then you sort of talk it out so that the offender can see more, not just there's a prison sentence potentially for what you've done, but actually there's a human being here who's been affected. And it's a way of trying to get the offender to stop offending by introducing them to a real person.
Yes. We did you're exactly right, but we did community restorative justice. So it was pre-conviction.
Okay.
So it was lower level antisocial behaviour, neighbourhood disputes, that kind of thing. And we worked in partnership with another organisation called Remedy, who did the post-court restorative solutions. So basically, it can work with all different types of crime, but it has a massive impact on the lower side of things as well. When the police are involved, so a crime's committed, but they're not necessarily going to prosecute. But that person effectively just gets away with it. There's no, sort of, what's the word? Judgment.
Consequence.
Yeah, consequence. That's it. But with restorative justice, we do a lot of work with both parties, victim and offender. We bring them together then once they're ready to talk about it. So neighbourhood disputes, for example, you've got 20 years potentially, more of issues between two neighbours, and they're all really minor things, but they build and build and build till this huge tower, and then one point someone's going to crack, and then it ends up in some sort of physical assault or something more serious.
I said fill the blanks in.
Sorry.
No, I have some knowledge. That's the thing, but I have a little bit of knowledge, and if you're not careful, it can be either really good or it can be quite dangerous. Because I know all about restorative justice. I know a little piece, which is why I'm saying fill in the blanks, because I don't know. And obviously, there's going to be different elements of restorative justice that you're going to be involved in. Right, let's move on to what you're doing at the moment, which is all around mental health. And I'm gonna introduce it this way. The UK right now has, I don't even know what the right word, pandemic, endemic, crisis. I mean, are there enough descriptive words? Probably not. We have young children who want to end their lives because of mental health pressures. And we've got, not getting political, but you've got government saying we need to find a way of toughening these kids up, which I heard quoted. Well, I'm going to say that one, which I don't think is particularly helpful, because we're not dealing with the reasons why there's mental health. And just toughening somebody up may have some degree of help. However, we can also create a nice big defensive perimeter of never dealing with the stuff that hurt them in the first place. So, what's the mental health project that ROC is involved in? Because I know that this is what I wanted to talk to you about today.
Yeah, it's scary, isn't it? What's happening? There's a 16-hour wait in A&E, all the time. So the NHS are in trouble. And they said, look, we need to think outside the box here. It's not working. We can't meet need. So there's two problems that happened last year. Basically, they said, look, the police are getting a lot of 999 calls. They're going out responding to mental health crisis. They're not the right people, and it's taking them away from crime. So they introduced a right care, right person at the end of last year, which means now those 999 calls aren't going through to the police. But where are they going? They're all going to A&E. So it's going to get worse. It's mental health is considered to be, a physical thing, not a criminal thing. But it's not. It can't be helped at A&E. I had a lady in with me yesterday. She's tried to take her life 16 times. Her son's 27. He's tried to take his own life. She went to A&E where she was told. She waited 11 hours and they gave her the number for Samaritans and sent her home. And you're like, there's nothing else they can do, really, there isn't. But we need to think of something, because there's a community around Wythenshawe that is incredible. There's so many incredible projects, there's so many incredible people. There are people that can help them. We have our service now, a listening space service in Wythenshawe. So the NHS could refer to us, but it's getting down those barriers to get them to do that. It's going to take time.
Yeah, I think the hospital thing's right. I mean, the hospital A&E is never ever going to be the right place to go if you've got a mental health crisis, because they can't help you, because you need longer term help. If you've got a crisis of that second, yes, they can help you potentially get access to a GP or whatever, but really the A&E is there when you've broken your leg. I mean, that's the whole point of what accident and emergency is.
Yes.
But it's kind of confirming the idea that mental health is actually an emergency situation. So that's useful in a negative context, but actually it's like the police. I mean, after 5 o'clock, there's sort of a joke I've heard before. Well, at 5:05, who's going to go and help the whatever? Well, it's going to be the police, because social services have stopped, mental health has stopped because they work 9 to 5. Who works 24/7? Well, it'll be the police, who all they can do is arrest somebody potentially and stick them in a cell. Well, that's probably not the right thing. Probably not something they can legally do. Yeah. What are they going to do? Well, they're going to arrive and leave again. Well, there's no crime. We can't. They're not there. So we've got this topsy turvy mess of people who want to help but have no capacity.
Yes.
Because a broken bone is immediately serious because it could be deadly. A mental health crisis is never going to be quite the same thing. Not that it's not serious. That's not what we're saying. But the A&E, that's not what we need. And without the community care, this is, I mean, it's all this mess, isn't it? That's what I'm trying to very
It's a
badly
mess.
describe.
We're basically missing another emergency service.
Yes.
You know, and that's why the NHS commissioned at the ICB, so the Integrated Care Board, have commissioned pockets across Greater Manchester. So every borough now has its own mental health crisis service, and they all look different. They're all called different things. They're all run by different community groups, charities. So this is exciting because now we have something. Wythenshawe's, we were commissioned in August. So we were the last borough to have one of these services. So we're all setting up. It is exciting. We need this to be 24/7. They're doing it as a pilot at the moment. But if we had an emergency service for mental health, we could direct people in the right way and to the right people, and we can talk to them. They have 111 option 2. So they've just launched that, which is basically non-emergency, but for mental health. So you can speak to someone at any point of the day, 24/7, and they are getting really good at that, but there's still a huge workload.
There's a bit of a void, isn't there, between where we need to be and where we've got to, where, I mean, I was trying to think how do I word it better, what I was trying to say, but if you go to A&E with a mental health crisis, your immediate risk isn't really as serious as someone with a heart attack or a broken leg, because that needs immediate care. However, it's not going to be many minutes before that person with a mental health crisis is now going to be in a much worse situation, because now they might take their own life. They might go and do something stupid. They might just have a violent outburst because it's too much to cope with. And there's a myriad of consequences, which, and this is the problem, isn't it? We're in a triage society almost of, well, this is the most serious. Yeah. Yes, it probably is. But the second thing that's most serious, well, it's not serious, but it's now perceived as not serious because now it's not the most serious, but actually it still needs help.
Exactly. And they're making mistakes left, right and centre because they're overworked. There is not enough capacity to treat everybody. My husband went in 18 months ago. He'd had a stroke, but they thought he'd had a panic attack. So they gave him diazepam and sent him home. So they missed it for 3 days. He's okay, but that's happening all the time, and it's not their fault. It's because there's not enough capacity to support everybody that comes in. So yeah, if we could take mental health people out of the queue, I would be really interested to know how many people are sat in that 16-hour queue with a physical accident or emergency, and how many were mental.
When you look through the COVID time, and hospitals were saying, great, this is how it should be at A&E. During COVID, nobody went to hospital, and everybody who went was seen. And the only people who turned up were people like I did with a major heart issue that needed fairly urgent care, or that kind of thing. And we could do with getting back to that. But of course, if the hospital's overloaded, the best they can do is stick a plaster on you and send you home, because they literally have no capacity. So this is in no way, negative on medical staff. They are overworked.
Yes.
But if we don't have community involved, hence redeeming our communities, you've got these fragmented societies and broken pieces that are not connecting in any way, which is why I love what you're doing, where you are in the spheres of influence you have, to actually connect the dots back together that forms a coherent picture of a good community.
Yes, agreed. I just had a gentleman in this morning who booked in with us. He's just been to his GP. His GP's prescribed him medication. That's what the GP can do, and I understand why they do that. But he's coming to see us as well. And I love that. It's not just medication that can solve these things. Medication is needed, I understand. But there are lots of other avenues out there, and that's the GP doesn't have the time to look through these things, but we do, and that's what our job is. And I think that if we could get to a point where everyone was working collaboratively a lot better, we would see so much more impact in people's lives. We would see them meet the right person quicker.
Yeah. There's a recurring thing through my interviews the last year and a half or so, and one of them is, and I often say this, and it's coming out again, but we look at the problem, we look at the scale of the problem and think, what, I can't help this. What can I do? I can't do anything. Well, actually, you can, but actually, when we work together, all of a sudden we can accomplish more than we can on our own. There's a lovely bit of scripture that where the cord of three strands can't be easily broken. Why? Because if you get a piece of rope, it can break. You knot it with two of the bits. All of a sudden, the amount of stuff that can do is phenomenal. And when you get three people together, it's that triangle solid shape. It's not going to fall over. It's so strong. But if we don't get people talking together and we just see the scale of the problem, not the fact that we can do something, well, nobody will help anybody. And I love what you're doing. You can't fix Manchester's mental health crisis, but you can help that guy.
Yes, exactly. And then we can say, have you thought about this? Have you thought about this? And one of the things that we're working on is this directory. So our signposting has gone to another level where you know what it's like to try and find out what is out there to support a man who's struggling with his mental health. You go on Google, you'll get a few things maybe, but it doesn't show everything. So people have done this in the past, haven't they? They've built a directory of services to support, but as soon as you print it, it's out of date. The numbers change, emails change, they close, different time slots are open, what have you. So we've designed using AI on ChatGPT, a directory which we're feeding all the time information just for Wythenshawe, so that when I have a gentleman in and I can say, okay, men's groups, I type in men's groups and it'll give me 25 different men's groups in Wythenshawe, the time that they're open, the contact number, the person to speak to, everything. And then I can copy it and text it straight to them. So they've got it on their phone, no leaflets, doesn't cost anything. It's going to transform our signposting. I'm really excited about this.
I often think that you think about kind of government level, they look at how many billions it's going to cost to fix this or that problem. And yes, it probably will. But I often think also a lot of what we can do to change society actually has zero cost. I mean, there's going to be people, there's going to be employment. We're not talking about that, but so often there's so much we can do. And I come back to this every time, smiling at the person when you're going shopping who's on the till. Getting eye contact and smiling can change that person in a moment. Letting someone in when you're queuing in a set of traffic can change that life. And I've watched it when I was trucking. I see somebody let somebody in a really bad junction, and now everyone is letting everybody else in. Now, they're not even whimsical. They're just small things. But imagine the power of actually sitting and listening to somebody who doesn't know what to do, being told, well, why don't you go here? Go and speak to that person. That essentially is one of the lowest cost options we can possibly ever dream of. Yes, we need to employ people, absolutely. But so much of what we can do doesn't cost us personally much at all, because if we smile at somebody, we've just brightened their day. And it's not a silly, pathetic thing. It actually helps.
It does work. I love that. And we sit in the Forum Health Centre all the time, just smiling at people walking past. And, they often they'll stop and go, oh, hi, what are you doing? We can tell them all about it, recruit our volunteers and raise awareness. And a few times they've stopped and gone, yeah, actually, I do want to talk to someone about my mental health. People new to the area, they're often coming in, registering at the GP. It's the first thing you do usually, isn't it? So they're walking through, and as they are, we can chat to them. So yeah, that smiling does open up a lot of opportunity.
It really does. I mean, we need to pay people to do stuff and be there. You're talking about 24/7. Volunteers are brilliant, but volunteers need something to work within, and that costs money to run. But I really enjoy what you're doing, trying to help one person at a time. I always think about we're trying to reach one listener at a time. That's all I'm ever trying to do. But you're trying to help one person at a time, because we can't solve the problems of 68 million people. Government can't. They keep trying. They're always going to fail because it's too big for one person or anything to do. But what we can do is help one person's life and not understand perhaps just how much of an impact that one person could have.
Yes, agreed. And I think you can go and set up another project here for this, and set up a project for men to support them, set up a project for people struggling with cancer. These things are all really helpful. But unless people know where they are, it's very difficult. So I don't think you need to recreate what's already going on, or duplicate what's already going on. Just directing people to those things has a huge impact.
So coming back to the specifics of what you're doing with ROC and mental health, what is it that you're actually able to offer people?
Okay, so we're a listening service primarily. So we're open to the public. Anyone can access it. It's completely free. It's aimed at people in mental health crisis, but we don't turn anyone away. So we'll speak to everybody who approaches us, who's referred into us. So we've engaged with lots of the different agencies, the GPs. We've spoken to the home-based treatment team at the hospital, the police, the housing association. Everyone knows about us and what we're doing. They can refer in to the service. So we try to listen, and then we signpost to the different services and support that's already out there for them. We try and help them make a little plan of what they're going to do next, the next step that they're going to take. But then we've also got access to 111 option 2 if we feel that that person is, it's quite extreme and they need emergency support, so we can either try and de-escalate them in that moment and refer them on, or actually this is serious, you need to see someone right now, and give them the information to get them there. We're also running monthly workshops on mental resilience, just to try and get people to talk about what it means to be resilient, share best practice with one another, a bit like a peer support group. We're also running a monthly podcast, which we're launching this month, where we're interviewing lots of people from the community about different ways that they've overcome some mental health crisis that they've had, to give people, a bit of encouragement of it can get better. And we're also recruiting and training volunteers, like you mentioned, to support our staff team so that we can help more people. We ran a community engagement event yesterday called Winter Warmer. We had over 200 people come to the forum. We were giving away winter supplies that we've had donated. We had lots of donations from a construction company, the forum themselves, Everyone Active, which is a gym, the Rising Sun pub in Hazel Grove did a collection over a few months. There was so many coats and scarves and gloves and shoes from Sal's Shoes, which is a charity as well in Manchester. It was incredible, and it was 3 hours. There was like 200 items of everything, and they just went. And we did hot soup, hot drinks. It was amazing. Loved it.
But again, there's nothing particularly complicated in what you did. It's not like groundbreaking, this has never been seen before. It's really simple stuff, helping people in the simplest of contexts. But that then becomes magnified to doing so much more than just a coat. Yes, it's just a coat. Well, it's not just a coat if you're freezing cold and can't afford your heating. Now you're actually warm. Now you're actually able to make more decisions. You're going to struggle less with your mental health, as it's going to have an impact. And just a coat can magnify to such a positive difference.
Yeah, and it did. And people were opening up to us left, right, and centre. Lots of the homeless people in Wythenshawe attended, and they're telling us about their situation. One man is struggling to get employment, but he's got no address. So it's like he's stuck in that situation. So just listening to their situations and then saying, I can offer you some support if you'd like to come. I think there's about 8 or 9 people we spoke to yesterday who are coming in today, and you just know that that was the catalyst, that sparked the conversation. And that's what we feel as ROC. The best way to engage and to start a service is by doing community engagement, finding the things that they need, using the facilities and using the support that we have from lots of other organisations to try and make it work. But it was great.
Fab. Thank you. I'm really enjoying just finding out about mental health stuff, because having done a bit of work with children in the past, it's one of those kind of missed out areas. Hearing people say, oh, they just need to toughen up. And I've heard older folks saying that, and I'm thinking, this isn't a war on our doorstep, toughening up. This is normal life. Nothing extreme is really going on. Toughening up isn't really the solution. Actually, why are people in a situation where they're struggling with their mental health? Well, there's lots of reasons that we can talk about for that. That's a different story. But actually, people who can then help and say, here's a coat, here's a hot cup of tea. I mean, winter spaces, warm spaces, that's something the churches can do. We had cold spaces in the summer, cool spaces, which is such a simple thing because big old church buildings, very big, insulated from the heat, better. There's so many simple things. Opening the doors of a church in the middle of the summer, what does that cost? A key.
Yes.
That's it.
Exactly.
How many lives can it make a difference to? Do you know what I mean?
Exactly. And have you noticed the figures, GP figures, police call outs and, NHS and in the accident and emergency, when it's a really nice hot day, there's not that many people going, and it sort of screams a bit of sometimes it might be an actual need. I don't want to put my electricity on. I can't afford to heat my house. And sometimes they even take a picnic into A&E. I've seen it. And you think, gosh, they're here for the day, And could it be a day out if they're struggling with the kids? I don't know. It could be something. There could be something in that.
Need to look into that one. Rebecca, thank you. If people want to access ROC generally, what's the website that people can come to? Because I'm presuming that will then link into your mental health provision as well.
Yes, www.roc.uk.com.
ROC.uk.com, ROCUK.com. Brilliant. Thank you. Thank you. It's been really good. Just finding out about the fact that people are trying to do stuff that's good, because we're living in a world where I think people think, oh, it's lots of bad, lots of evil. Well, yes, there is, there always will be, but there's also good.
Yes.
I'm not going to go into Lord of the Ring quotes, but there is stuff that out there, and it is good, and it is worth fighting for. So thank you for fighting for people's mental health, specifically this particular project within ROC. So Rebecca from ROC, thank you.
Thank you.